everybody, my name is Carol Mack. This tutorial will cover the flexibility rule. It allows providers to choose the best security measures for their organization. The privacy rule includes a mini-security rule that requires general safeguards. The mini-security rule simply required appropriate safeguards for PHI. In 2005, the security rule added new specifications for electronic PHI. However, the security rule applied only to electronic PHI. When the privacy rule took effect in 2003, covered entities had 2 years to prepare for the security rule. In 2005, most small practitioners used only paper. Practitioners could avoid the security rule by avoiding electronic PHI. Electronic PHI includes hard media such as computer hard drives and DVDs and transmission media like private networks and the Internet. Certain kinds of media are specifically excluded from the definition of electronic PHI. Paper documents are presumed non-electronic. Fax transmissions are not electronic. PHI that's not in electronic form before it's sent is not electronic. Telephone calls are not electronic. In 2010, the HIPAA Act added breach notification rules to the code. Breach notification applies to paper and electronic PHI. HIPAA extended the security rule to business associates. Covered entities and BAs must comply with the security rule specifications. Implementation specifications may be required or addressable. For each addressable spec, the entity must assess whether it's reasonable and appropriate for their business. If the answer is no, the entity must consider alternative measures and document reasons why the addressable spec was not implemented. Flexibility of approach applies to all of the security safeguard standards. Entities may choose measures that are reasonable and appropriate for their activities. In deciding what security measures to use, entities must consider their size, complexity, and capabilities, and their technical infrastructure, hardware and software capabilities, and the costs and probability and criticality of potential risks to electronic PHI. Now we'll study flexibility in the town of Single Peak. A few months ago there was a fire in a building on the plaza across from the Pruitt Medical Group. The building was repaired and the owners put an outdoor antenna on the pole outside. They wanted everyone in the park to have wireless access whether they wanted it or not. The Pruitt Medical Group also got an unsecured hotspot. In all of her days practicing medicine, Priscilla never imagined patients would bring computers to the office.
Hudson, one of my patients was talking about cyber criminals. Do you know what HIPAA has to say about public Wi-Fi?
HIPAA allows flexibility in designing security safeguards.
What does that mean?
Let's ask Computer Guy.
Hudson called the IT consultant. His store was a short distance from the Pruitt's office. Guy agreed to come over to help the doctors understand the situation.
I understand you're worried about the new hotspot.
Yes, why don't we talk in the conference room?
Public Wi-Fi has no security. It uses public radio waves. Anybody who uses it should have no expectation of privacy.
Do you suppose we should shield the windows from the hotspot?
The security rule requires reasonable measures. Shielding the building would be unreasonably expensive and not very effective.
The flexibility rule says we must consider our size, complexity, and capabilities. Given our small size, would it make sense to use Ethernet? Should we hardwire everything?
Ethernet is not a complicated system and it's very secure, but you will need a wireless signal to operate your mobile devices.
We also have to consider our technical infrastructure.
Your internet connection is delivered through a DSL line. That green cord is sending data to the modem and router and through the firewall, and then it goes to your computers and wireless devices.
Do we have security capability to block the hotspot?
No, but we can block unwanted traffic by hiding the name of your network. You can see we've disabled the SSID so it won't broadcast your identity. Even if a hacker were able to find your network, they'd have to enter the right credentials. A hotspot in the plaza is risky because anybody can join. You can see there's no lock symbol.
Are we obligated to protect our patients' computers?
Probably not. But we have to consider the probability of risks to electronic PHI.
You could at least warn your patients. You may have noticed the public library has posters that warn you about public Wi-Fi. A poster is a low-cost solution to the problem, but the best solution would be to create a secure access point for your patients.
That's a great idea, but how much would that cost?
I'll give you an estimate tomorrow.
Flexibility is an important part of the security rule. The security official must evaluate the likelihood and impact of potential risks before they do a cost analysis. Thanks for joining me in this tutorial. Now I want you to meet my colleagues, Roman Diaz, President of Touchtone Compliance, and Karen Darnall of Darnall Law Office.
We made these tutorials to help you learn about HIPAA and California law. For individual attention, go to our contact page. You can send us a message or schedule a consultation.
And I'm Roman Diaz, President of Touchtone Compliance. Our online tools and expert services provide everything you need to successfully address HIPAA compliance. We identify vulnerabilities, provide a thorough risk analysis, and assist with mitigation plans, policies and procedures, and staff training.